Concurrent preventative strategies. The COVID-19 vaccine effectively protects us against severe illness, admission to the hospital, and death. However, it is still possible to get COVID with mild symptoms or none at all. So, whether we are vaccinated or not, we can take simple preventative steps like wearing a mask or washing our hands to prevent getting infected and spreading the virus. In this video, we will explain why preventing infection is essential even after getting vaccinated and how it can protect vulnerable people in our communities. We will also review important preventative behaviors for you and your clients to stop the spread of COVID-19. Why follow preventative strategies even after vaccination? Even after being fully vaccinated against COVID-19, it is possible to get a mild COVID infection. Vaccines are a safe and successful way to prevent serious illness. Most vaccines that we use today, including the one for COVID-19, do not prevent you from being infected by a virus. Instead, they teach your body to recognize and fight the virus should you become infected. This immune response prevents you from becoming very sick or dying from COVID-19. After being vaccinated, you do not have immediate strong protection against COVID-19. It takes time for your body to build strong immunity, which can be up to 2 weeks after the final vaccination dose. This means that you are still vulnerable to infection. Remind your client that preventative behaviors are especially important during this time. You will also want to explain to your client that if they contract COVID after being fully vaccinated or between vaccination doses, they can still transmit the virus to others even if they have mild or no symptoms. This puts other people at risk of developing the disease and potentially becoming very ill, especially if those around them are not vaccinated, are older, are pregnant, have a weakened immune system, or have an underlying medical condition that is not well controlled, like heart disease, diabetes, asthma, or another lung disease. As viruses spread, new versions or variants of the virus can appear. Your client may ask you if the vaccine works against COVID variants. It is important to know that international health organizations, like the World Health Organization, and medical professionals are constantly monitoring vaccine effectiveness against these variants, as well as discovering ways to boost the vaccine's effectiveness. By taking action to prevent the spread of the virus, you not only protect yourself and others from infection, but also reduce the chances of creating new dangerous variants. Our knowledge of COVID is rapidly expanding, and as you have likely seen, information and recommendations may change over time. So, you'll want to be sure to share reliable and trusted information and to be honest with clients about those things that we don't yet know. Remember that you can always refer to other videos in our series about finding trustworthy sources of information and addressing misinformation. A reminder of effective preventative strategies. Now that you have explained the importance of preventing infection and transmission even after vaccination, it may be helpful to refresh your client's understanding of effective strategies to prevent transmission of the virus. Remember that COVID is spread by breathing in respiratory droplets in the air when someone coughs or sneezes. The virus can also be transferred from one's hands to your mouth, nose, or eyes. Here are some strategies that may be helpful to share with your clients. To prevent the spread of COVID-19, even amongst those who are vaccinated, you can 1. Always wear a mask that fits well and covers your nose and mouth, as it protects both you and others from breathing in or spreading the virus. 2. Stay away from crowds and practice social distancing by staying 1 to 2 meters from others. This prevents you from breathing in any droplets that may contain the virus. 3. Avoid poorly ventilated indoor venues that are crowded, as this may allow the virus to spread more easily. If possible, open the windows and doors to increase airflow. 4. Avoid touching your eyes, nose, and mouth, as this can transfer viruses from your hands to your body. Keep your hands free from viruses by washing them regularly with clean water and soap for at least 20 seconds. You can alternatively use an alcohol-based hand sanitizer. 5. Try not to sneeze or cough into your hand. Use your bent elbow or tissue to prevent spraying the virus. Throw away the tissue afterwards and then wash your hands or use sanitizer to destroy any viruses. You may want to talk with your client about other preventative strategies, including some of the following. Remind your client of the importance of having the required vaccine doses at the recommended times. This will ensure that they get the greatest amount of protection against COVID-19. Advise your client to stay away from anyone who is sick if they can, to reduce the chance of getting sick themselves. If they are caring for a sick person, it is critical that they practice preventative behaviors such as hand washing. If they don't feel well themselves, tell your client that staying at home or away from others as much as possible is best. It can become more challenging if your client lives with family members or others who are not vaccinated. In this case, they should employ preventative behaviors, and you may suggest that they encourage vaccination amongst eligible individuals, especially those vulnerable to disease, such as elderly parents. Now that you have shared your knowledge about vaccination and preventative behaviors with your client, they are in a good position to inform their family members, friends, and children. They should also share ways to prevent the spread of COVID-19 with any caregivers, neighbors, or teachers who spend time with their loved ones. So, what can you do? As you interact and have conversations with community members, make sure that you have the latest knowledge on vaccines, the current variants, and preventative recommendations. You can also act as a role model by following the preventative guidelines as recommended to help prevent the spread of COVID-19, such as hand washing and wearing a mask. People in your community look up to you and rely on you to help them stay healthy. Help protect yourself from getting COVID-19 as much as possible by also using these preventative measures. As you engage with many people every day, you are at a higher risk of being exposed to COVID-19. You are also in contact with people who may be ill, may have weakened immune systems, or may have underlying conditions. It is important that you are protected and that you are able to help protect others. Keep spreading the message that being vaccinated is the best way to prevent severe illness, hospitalization, and death. By getting as many people vaccinated as we can, we will be able to stop the spread of COVID and save lives.